Hi students, today we are going to see on the topic pit and fissure sealant. Myself Dr. Lubina Fathima, Senior Lecturer, Department of Public Health. Now these are the contents I am going to cover in pit and fissure sealant. First I will be giving a brief introduction, definition of pits and fissures, then moving on to fissure sealant, morphology, history of pit and fissure sealant, classification of sealant, indication, contraindication, techniques of sealant placement. Now, what is the definition of pits? Pits are nothing but small pinpoint depressions located at the junction of the developmental grooves or the terminal of those grooves. This definition was given by Ash and Nelson. This Ash and Nelson will be one of your Viva question. If you tell the definition of pits, we'll ask which author gave it. It's Ash and Nelson. Now next moving on to fissure. Fissures are nothing but deep clefts between adjoining cusps. This occurs on occlusal surface of the molars and premolars with configuration that are difficult to access from the surface. This is a definition given by Orbens. So remember, pit definition was given by Ash and Nelson. Fissure's definition was given by Orbens. Now next moving on to the pit and fissure sealant. So it's nothing but a material. So the definition goes by a fissure sealant is a material that is placed in the pits and fissures of the teeth in order to prevent or arrest the development of dental caries. So why this pit and fissure sealant is used is just we are going to arrest the dental caries. This is one of the preventive procedures. Now tell me, what are the other preventive procedures we use in our dentistry? It's nothing but atraumatic restorative technique, which is called as ART, PRRR, preventive resin restoration, and a tropical fluoride application, which will give 1.23% APF gel. Okay. So this definition of fissure sealant was given by European Academy of Pediatric Dentistry. So remember students, pit and fissure sealant is a preventive procedure. Moving on to the morphology of pit and fissures, Nagano in 1961 described the following principal types of fissures based on the alphabetical description of the shape. It's V shape, U shape, IK shape, inverted Y, I-type and fissure system. So in the middle is the fissure system, how exactly the fissures goes on. So now let me tell you which is actually a caries prone type. So caries prone type is nothing but which one? I-type are caries susceptible type, whereas V-type and U-type are caries resistant type. So remember this, okay? And the percentage, this might be asked in your NEET question. So V-type is present approximately in 30 to 35% of the individuals, whereas IK type is present in 24 to 26% of the individual, and I type is present in 18 to 20% of the individuals, and inverted Y type is present in 5 to 10% of the individual. So remember these percentage just for a NEET purpose, but in our exam it's enough if you write what are the types and which is caries resistant and caries susceptible. Okay, remember that. Now next is the history of fluorides. In 1905, Miller used silver nitrate. So the evolution of pit and fissure sealant was from the Miller in 1905, which used silver nitrate. And in 1923, it was Hayat prophylactic odontomy. 1929, Bodector gave fissure eradication. 1955, Bonacor gave acid etching. So in 1962, it was bis GMA resin, which was given by Bowen and Associates. Here you have to particularly remember the prophylactic odontomy, which was given by Hayat in 1923 and Bodector 1929, which gave fissure eradication. Okay. So next, moving on to classification of sealant material. We classify the sealant material based on resin based sealant, glass ionomer sealant, polyacid modified resin sealant. And based on the resin based sealant, we classify into 4 types based on the curing light. So first is the first generation, which is UV light, which is of 350 nanometer. Second generation is self cure with tertiary amine as activator. Third generation is visible light of 470 nanometers. When you go with the range, it is 430 to 490 nanometers. Fourth generation is fluoride releasing. Important generation, fluoride releasing is one of the most commonly used generation because fluoride is one of the anti-caries property it has. So fourth generation is a very good system to use, okay? But we commonly use third generation also. Next is based on the fillers, it is classified as filled and unfilled. Based on the translucency, it is classified as opaque and transparent. Just a recap of whatever we have taught. First, we are going to classify it as resin based sealant, which is transparent and opaque, and here it goes on for the ultraviolet light polymerizing agent. autopolymerizing, light polymerizing, fluoride releasing. And filled and semi-filled is based on the filler particles. Glass ionomer cement, here we classified into conventional glass ionomer cement and resin glass ionomer cement. Next is the polyacid modified resin sealants. So this is the main classification of Pitt-and-Fisher sealant. And we also saw the types. Okay, next. What is the indication of this Pitt-and-Fisher sealant? Now, depending on the age, 3 to 4 years of age for a primary molar sealant, this application can be given, or 6 to 7 years of age when the first permanent molar is adopted, you can give this Pitt-and-Fisher sealant. 11 to 13 years of age for the second permanent molar and premolar, you can give. Children and young people with medical, physical and intellectual empowerment with high caries risk. Children and young people with signs of higher caries activity and coming from non-fluoride area, these Pitt-and-Fisher sealants are indicated. So always remember, for a newly erupted teeth, okay, newly erupted teeth, this Pitt-and-Fisher sealant is one of the indications. Now next, moving to the contraindication. Contraindication is shallow Pitt-and-Fisher sealant. This is contraindicated. Open occlusal caries lesion with extension into dentin, your Pitt-and-Fisher sealant is contraindicated. Presence of large occlusal restoration. Presence of proximal caries extending onto the occlusal surface. Partially erupted tooth and uncooperative children, you avoid this Pitt-and-Fisher sealant. Next is the technique of Pitt-and-Fisher sealant. I will be telling one by one what are the steps involved in the Pitt-and-Fisher sealant. First, make sure that you polish the tooth surface before you start your Pitt-and-Fisher sealant. In what you polish with your pumice buds. Okay, so make sure that you polish your. Next is the isolation and dry the tooth surface before you start your Pitt-and-Fisher sealant. For every success of the treatment, your isolation plays a very major role. So before doing any treatment, first isolate and dry the tooth. Next is acid etching. We all know that we use 37% of orthophosphoric acid. Remember this, students, if it's less than 30%, what will be formed, and if it's more than 50%, what will be formed. If it's less than 30%, dicalcium phosphate dihydrate is formed, and if it's more than 50%, monocalcium phosphate monohydrate is formed. So remember this, in orthophosphoric acid, this is one of the most important thing. And here is 20 seconds of the acid etching you will be doing in your Pitt-and-Fisher sealant. And make sure that you remove your slime layer while doing an acid etching. These are the key points to remember while doing sealant. Now washing and drying. So washing and drying, wash for 30 seconds. Okay. Then dry it for 15 seconds. Remember these two codes. Wash for 30 seconds and after that dry it for 15 seconds. Now what do you see after acid etching? You see a white frosty appearance. If you see this white frosty appearance, then there is a success in your etching. If this white frosty appearance is not seen, then repeat your etching again. Remember, this white frosty appearance is an important step for etching. If this is seen only, your etching is success. Next is again isolation and dry the tooth surface. Bonding, which I have mentioned in the pic in the slide. Okay. Now next we will go to sealant placement. So remember, in mandibular teeth, apply the sealant distally. So you are going to apply distally in the mandibular teeth and allow it to flow mesially, with the convex being true for the maxillary teeth. During the application of sealant, care should definitely be taken to prevent incorporation of the air bubble. What happens if the air bubble gets involved? Definitely your Pitt-and-Fisher sealant might be a failure. It might come out. So remember, you should do without incorporating the air bubbles. Curing. So curing should be done in 30 seconds. Remember, curing will be done in 30 seconds. Now next, after placing the Pitt-and-Fisher sealant, you are going to evaluate with the high points and overhangings. So after you have finished the restoration of Pitt-and-Fisher sealant, just tell the patient to bite and see whether there are high points. If there are high points, reduce it. If not, it's perfect. No, it's not a problem. And make sure that there should be no overhangings. Overhangings may cause more contraindication to the patient and more caries. You will be prone that too to the caries. So remember this, if overhanging and high points are being present, you are inducing the patient to more caries. So remember these two things. Next is just a quick revision of whatever we saw. What we saw, first we saw the history. In that, Miller in 1905 was the starting point of our history of Pitt-and-Fisher sealant. Then in 1923 it was Hayat, and in 1929 it was who? Fissure eradication, which was given by Bodecker. So remember this. Then we moved to U type, V type, IK type, and then based on the curing light, we classified into 4 types: UV, visible light, chemical curing, and fluoride releasing. So we saw 2 nanometers. What are they? 350 nanometers and 410 to 490 nanometers. And 4th generation is fluoride releasing, which is commonly used. So remember all these key points for a Pitt-and-Fisher sealant.